I'm super excited to have not only a friend, but someone I personally trust in the space. This is Rhett Polka, the owner and founder of 180 PT. Welcome, Rhett.
Hey, thanks.
Yeah,
Good to
thanks
be
for
here.
being on.
Yeah,
I'm really excited about today's conversation. We're going to dive into talk about healthy aging and what does that look like? What does that feel like as people are aging? What do they need to be thinking about as far as agility and mobility and strength and all of that? So before we do that, why don't you just tell our listeners and anybody watching a little bit about yourself and where 180 PT comes from, as they know this is a patented technique that you have personally founded, for lack of better terms. So tell us more about it.
sure. So I was born and raised in Loveland, Colorado, where my PT clinic is. Typical growing up playing a bunch of sports. Got interested in strength and conditioning when I was about seventh grade. So I went in, started training before school in seventh grade. Thought that's what I would do as a profession, getting older and just working with athletes. Ninth grade, I tore a muscle, had to go to physical therapy, walked in there and I saw some of the things that were in the gym that I trained at. And then I saw anatomy posters and then other machines and people rehabbing injuries. And I thought, well, this might even be better than just like lifting weights forever. So from ninth grade on, I knew I wanted to be a physical therapist and do quote unquote sports medicine. So went through, continued to play sports through college. Got out, went to PT school, thought everything was going to be really cool. Actually got out of PT school. My first job was at the clinic that I was at a patient at in 1988, and now we're in 2000. And I noticed nothing had changed.
Hmm.
So after 7 years of higher education, getting a doctoral degree, becoming board certified in strength and conditioning, board certified in orthopedics, I found that I was extremely frustrated and confused as to what I was doing and why I was doing it. My patients liked me. They thought they were getting better, but what I noticed is they kept coming back with the same issues, and that felt to me like I was just basically covering up symptoms for the short term, and they would just come back again. So that was kind of the crossroads where I figured out that I either needed to stop doing physical therapy and just say, forget the last 7 years of my life of going to school, or figure out if there's a better way to do it. So I started on about a 2 to 3 year journey of just ripping apart textbooks and looking at physiology and trying to figure out what the missing piece was and taking as many continuing ed courses as I could. And I figured out that nobody out there in physical therapy was actually getting to where I wanted to get to. I wanted to finally figure out what the root cause of all these patients' problems was. And once I figured out that it was all physiology, all biomechanics, and I needed to become a better critical thinker to put that together, then things started to fall together. I started to get people better a lot faster. They weren't coming back with the same issue over and over again. And that's when I figured out that I was doing the opposite of everything they taught us in school and the opposite of every one of my coworkers. So I knew I needed to leave. So I opened my own clinic a little bit over 20 years ago. No business experience, no idea how to bill insurance or anything like that. Just started winging it. And here I am 20 years later. I've had multiple locations. I'm teaching people around the world. As you said, the patented 180 system, which is what I came up with. And the reason why I call it 180 is because it's the opposite of what everybody else does.
It's amazing. I love that story. And, a couple of things you said there resonate with me as an athlete and someone who does a lot of physical activity. The ongoing nagging pains and aches that you just can't get rid of, for lack of better terms. And I've gone through physical therapy, I've gone through deep tissue work, Graston, ART, all the things, right? And it sort of solves it for a period of time, but it's a band-aid, right? It doesn't actually fix the root problem. And again, I will openly share, I have been a patient now for, I don't know how many months, but probably at least 6 months, maybe I've been seeing you. It's a change in mindset, for lack of better terms, and how to address the muscle and nervous system and integrating that from my layman term of understanding how to actually make the proper muscles fire at the right time that tend to go to sleep, for lack of better terms, when they're not being utilized. And when they're not utilized often enough, then you rely on the bigger muscles. And the smaller muscles don't and nervous system aren't working the way they should. So anyway, I probably said that all wrong,
No, it's pretty
but
good.
oh, thank you. But from a layman's perspective, it works. And so, outside of tooting your horn and promoting you, which I'm of course happy to always do, I do want to jump into this concept of healthy aging, right? And so let's start with the big question in mind, right? What does healthy aging mean to you ultimately, and how does movement play a role in that?
So, from being in this profession for so long and dealing with patients from, little league athletes all the way through grandmas that just want to pick up their kids and or their grandkids and play, healthy aging to me is being able to do what you want to do without feeling like you have to like wear a brace or put something on it to make it feel better or just avoid certain things. So my vision of healthy aging is you do what you want to do without thinking about anything.
Hmm.
Like when I tell patients, like, I want you to go do what you want to do, and I don't want you to think about walking differently. I don't want you to think about keeping your back straight when you bend over. I just want you to go do what you want to do. And if you can do that without pain and without thinking about what you're doing, that's healthy aging, healthy living. That's the whole goal.
Sure. Makes sense to me. With that, as we age, what would you say are some of the most common misconceptions people have about either exercise or physical activity?
So unfortunately, we've become a society that looks for we've set the bar so low that we only want to cross the bar when it's this low. So I have a lot of people come in, especially the older people that come in, and I'll give them really simple exercises, kind of like what I gave you, really easy. You can do them anywhere. You don't need equipment. The
Sure.
whole point of these exercises is to keep your nervous system and your muscles working together. And they come back for their second visit and they'll say, well, I did some of your exercises, but on the days that I didn't do those, I made sure that I went for a walk. So walking in my book, unless you're a cardiac rehab patient, is not exercise. Walking is a mode of transportation to get from point A to point B the easiest way. Okay. So walking doesn't require end range of motion for you to get your joint to move out of neutral by much. It doesn't require you making muscles work harder so they at least maintain strength. It doesn't make you work on balance so you're decreasing your fall risk. So walking to me is the bar set so low that's what everybody wants to shoot for. So what I tell people is I'm going to give you really easy exercises, and the whole point of those is to keep your muscles working. Because if we can keep your muscles working, you can maintain range of motion, you can maintain your balance and stability so you're not falling down. And if you do catch a toe on something, you have the strength to stop you from going all the way to the ground. So that's exercise to me, and exercise is at least getting the muscles to function so they can help you continue to move so you have that healthy aging lifestyle.